Hey everyone, Gabby here from Team Bootcamp, and today we'll be going over the anterior abdominal wall. So the anterior abdominal wall can be divided into 4 quadrants, and this is done using a variety of different planes. So the first plane that we have in blue is the median plane along the median aspect of the body, and then we also have in purple here the transumbilical plane. So these planes essentially create our 4 different quadrants. So we have 2 on the right side. So we have a right upper quadrant and a right lower quadrant. And then we have 2 on the left side. So we have a left upper quadrant and a left lower quadrant. And you can see that within these quadrants, we have different organs that are located within these quadrants. And here I have a table, I'm not going to go through the entire table, of which organ is located in which quadrant. So I'm just going to give you a few examples here. So if we look at our big organ here, the liver, we can see that the liver is located in the right upper quadrant as well as the left upper quadrant. And we can see that in our table right here and here as well. So it's going to be a useful tool for you to use in order to see which organs are in which quadrants. Along with quadrants, the abdomen can be divided into abdominal regions, and there are 9 total abdominal regions, and these regions are again created by different lines and planes. So the first one that we have here, within the midclavicular plane, which is in green, which will contribute to our vertical axis. And then we also have the subcostal plane. So costal means rib and sub means under. So this is essentially meaning under the ribs is going to be in blue. And then we have our transtubercular plane, which is going to be here in pink. So these all come together to form our 9 quadrants. So if you look on the right side, we do have 3 on the right side. So we have the right hypochondrium, the right flank or the right lateral, and then we also have the right inguinal. If we look more medially, we have the epigastric, the umbilical, and then we also have the pubic or hypogastric. Depending on the textbook you're reading or the resource you're reading, they may use one or the other, so it's good to be familiar with both. And then on the left side, we also have the left hypochondrium, the left flank or lateral, and then the left inguinal. So again, certain organs or structures are located within these regions and essentially helps us identify where these organs are located. So let's talk about some referred abdominal pain. So referred pain itself just means pain that is occurring in an area that it's not essentially coming from. So other foregut structures, so this includes the esophagus, the stomach, the first and second part of the duodenum, the liver, the pancreas, the biliary apparatus, and the gallbladder are all foregut structures. And any visceral afferents that are coming from these organs are going to be referred to the epigastric region. And we can also see that in this image here, is that within the epigastric region, we do see some of those organs. This is specifically a referred pain chart, so we do have other organs there that are not necessarily for the foregut, and this can be a useful tool even for you later on to see where this referred pain may be coming from. And the reason that we do get this referred pain is because the brain is often confused when it receives visceral afferent information. It is not used to getting all the sensory information coming from these organs. So essentially what happens is that these visceral afferents are going to travel retrograde with the sympathetic pathway. The sympathetic pathway is going from the spinal cord to these organs, whereas the referred pain or the visceral sensory afferents are traveling from the organs to the spinal cord. So they're traveling retrograde with the sympathetics. And the foreguts specifically are sympathetically innervated by the greater splanchnic nerves, which branch off of T5 to T9 nerve roots. So essentially what's going to happen when we do get those visceral afferents from these foregut structures, that signal is going to be sent along the greater splanchnic nerves retrograde, and essentially the brain will be like, what the heck is going on? I'm kind of confused, and will eventually emit sensory information to these T5 to T9 areas, also known as the T5 to T9 dermatomes. And if you go ahead and look at the dermatome map, you will see that T5 to T9 dermatomes are kind of located within that epigastric region. So that's where we're going to feel pain if there's anything going on with these foregut structures. Now moving on to the midgut structures. So again, we're still talking about referred pain and the same concepts apply. So the midgut structures include the second, third, and fourth part, the duodenum, the jejunum, the ileum, the cecum, along with the appendix, the ascending colon, as well as the proximal 2/3 of the transverse colon. So instead of you feeling the referred pain in the epigastric region, you're going to feel the referred pain in the umbilical region. And the reason for this is that the midgut structures receive sympathetic innervation from the lesser splanchnic nerves, which branch off of T10 to T11. So again, those visceral afferents from these midgut structures are going to travel retrograde through this lesser splanchnic nerve, and pain will emit through those T10 to T11 dermatomes. So again, if you do look at the T10 and T11 dermatome map, you will see that that area is along the umbilical region over here. And again, similarly applies with the hindgut structures. So we have the distal third of the transverse colon, the descending colon, the sigmoid colon, as well as the rectum, specifically the anal canal that is above the pectinate line. And these structures receive innervation or sympathetic innervation from the lumbar splanchnic nerves, which branch off of L1 to L2. And you would essentially feel this referred pain within the pubic or hypogastric region in this area over here. So let's see what you've learned so far. So the 4 abdominal quadrants are created following which 2 lines/planes, select all that apply. And then the 9 abdominal regions are created following which 3 lines and planes, select all that apply. So pause the video, answer these 2 questions, and then come back when you're ready. So for the first question, the 4 abdominal quadrants are created using the median plane along the vertical axis and then the transumbilical plane along the horizontal axis. And then the 9 abdominal regions are created using the 2 midclavicular lines for the vertical axis, and then the subcostal plane for the superior horizontal axis, and then the transtubercular plane for the inferior horizontal axis. A young patient comes into the clinic complaining of pain in the epigastric region of the abdomen. Where is this pain most likely coming from? And then where would you most likely feel referred pain from the midgut? So pause the video, answer these questions, and then come on back when you're ready. So for this question, we're looking at the epigastric region, and as I mentioned earlier, it's going to be those 4 gut structures that receive sympathetic innervation from the greater splanchnic nerves that come off T5 to T9 that will essentially have referred pain to that epigastric region based on those dermatomes. And then for this question, for the midgut, you're most likely to feel pain in the umbilical region following those lesser splanchnic nerves, so T10 to T11 dermatomes. Here are the references for the images that I used. And then just to summarize what we've gone through the 4 abdominal quadrants that are found on the anterior abdominal wall. We also looked at the abdominal regions, and we also looked at the different planes and lines that actually contribute to these quadrants and regions. And then we also talked about the referred abdominal pain that can occur from the foregut, so the epigastric region, from the midgut, which is the umbilical region, and from the hindgut, which is the pubic or hypogastric region.